Hello students, welcome to a new video. So today's video is going to about a serious disease condition which is a very communicable disease. So in this picture we can see there are two profound symptoms or clinical features are there, that is chronic cough and profound weight loss. So this main manifestation of a communicable disease which is caused by bacteria, that is called pulmonary tuberculosis. So the pulmonary tuberculosis is basically the definition is basically the pulmonary tuberculosis is serious infection which is caused by mycobacterium tuberculosis and which basically involves the our respiratory organ, that is the lung. So the pulmonary tuberculosis is related to our lungs, and there is the extrapulmonary tuberculosis is also there. So the the tuberculosis or mycobacterium tuberculosis can affect or can damage or can affect our any parts of the human body except our hair and nails. So there are different category or types of tuberculosis are there, that is bovine tuberculosis which mainly affect the cattle. So next, coming to the related anatomy and physiology. So behind the pulmonary tuberculosis there is the anatomy of our respiratory system. So we all know our respiratory system is comprises of upper and lower respiratory system. So our respiratory system is comprises of nasal cavity, nostril, pharynx, larynx, trachea, and our two lungs, that is right and left lung, and the right lung is divided into three lobes and the left lung is divided into two lobes. Okay, so next, coming to the point, that is a risk factor. So if we see that our pulmonary tuberculosis is basically it is caused by mycobacterium tuberculosis, which is a bacteria, and it is highly communicable disease. It can be transmitted. Okay, so the main risk factor, so because of it is a communicable disease, so the risk factor are close contact with someone who have active TB. So the person who have already an active case of TB, if a healthy person is came contact with that person, active TB person, so the infection can easily transmit it. Next, the immune compromised status, like if the person has any chronic infection, a pre-existing chronic infection like CKD, chronic kidney disease, or diabetes mellitus. So those kind of diseases are chronic stage of disease. So in that case, the person's immune system is already in compromised state, in breakage state. So that's why any possible infections can easily invade the person immune system. So that's why a person who is already immune compromised or already in compromised state, so those person can easily contaminated or easily can get the disease. Next, the drug abuse and alcoholism. So if the person is taking any invasive drug or any IV, if the person is taking IV drug or any substance abusing, so that person already immune system is compromised, as well as by sharing needle through which it can also be transmitted. Next, pre-existing medical conditions and the immigrants or the malnutrition. So if the person is suffering from any malnutrition or any deficiency, any macro or micronutrient deficiency, or any immigrants means if a person is moving from a high incident rate of tuberculosis state or area to a low incidence or comprisingly a healthy area or epidemiological area, so that person can carry the infection to a better area. So that is the immigrant. Next, the clinical manifestations of the sign and symptoms. So we all know that the tuberculosis is infecting our lungs or respiratory system. So basically, depending on that, the symptoms are like that way, because it affecting our respiratory tract. So the symptoms are productive and prolonged cough that is lasting or that is staying that more than 2 weeks. So if the cough is prolonged and productive and it lasts more than 2 weeks, that is the foremost important sign of tuberculosis. Next, coughing up with blood. So hemoptysis can be seen. Next, the fever. So due to the infection, there can be symptoms of low grade fever. Next, night sweats. So night sweats is a common symptoms of pulmonary tuberculosis. Next, the significant weight loss. So due to the Mycobacterium tuberculosis infection, there is increased metabolism and there is profound weight loss is seen. Next is loss of appetite. So those are the main symptoms of pulmonary tuberculosis. Those are productive prolonged cough that is staying more than 2 weeks, coughing up with blood, fever, night sweats, and weight loss. Next is the diagnostic test. So before moving to the diagnostic test, we have to know. So the first we have to take the history and physical examination. So in history, what type of history we have to take? That the patient's cause, we have to identify the risk factor. If the patient is suffering from any chronic infections or patient is suffering from any malnutrition, so those kind of information we have to take from the patient. Then we have to examine the patient's sign and symptoms is present in the patient's or not. So you have to check the patient carefully by physical examination. Next, we can do the tuberculin skin test. So by the tuberculin skin test, here purified protein derivative that is inserted in the forearm of the patient and form a induration over the forearm. And if the forearm in the induration if formed, and we have to measure the induration depending on the measurement of the induration after 72 hours of insertion of the injection or PPT. So a purified protein derivative is present. So we have to insert that purified protein derivative intradermally in forearm, and we have to check that area after 72 hours, and we have to check the induration and we have to measure the induration. So depending on the measurement of the induration, we can categorize the patient if the patient is positive or not. Next, we can do the chest x-ray. By imaging study, we can identify the site of infection, in which area of lungs is involved or lobe is involved with the Mycobacterium tuberculosis. Next, we can do the interferon gamma release assay, so through which we can identify the bacteria. Then the bacteriological study, microscopic examination we can do, that is the acid fast bacilli. So we all know Mycobacterium tuberculosis is acid fast bacilli, so through which we can do the microscopic examination. And next we can do the CBNAT test, that is cartridge based nucleic acid amplification test, through which we can identify the nucleic acid structure of the Mycobacterium tuberculosis. Next, the management. So we all know that Mycobacterium tuberculosis, the pulmonary tuberculosis, the management are there, that is first line drug and second line drug are available. So the first line drug, that is foremost important drug, those drugs are used to treat the patient, that is the isoniazid, rifampicin, streptomycin, pyrazinamide and ethambutol. And the second line drugs are fluoroquinolones, ethionamide, amikacin and capryomycin. There are others antibiotics are there which can be used as a second line drug, but the drugs of the tuberculosis, so basically the first line drugs are used to manage the tuberculosis cases. If the person is not responding in the first line drug, if the person is multi-drug resistant tuberculosis, so in that case we can administer second line drug. But the DOTS therapy, there are directly observed treatment short course chemotherapy which is present there, but those DOTS therapy is need a next class. So the side effects of anti-tubercular drugs. So main side effects or very important side effect for a significant drug, that is for isoniazid, there is a significant side effect is hepatitis and vitamin B6 deficiency. Next, the rifampicin, the main side effect is orange discoloration of body fluids. For the pyrazinamide, the side effect is arthralgia and the hyperuricemia. For the ethambutol, there is the side effect of ocular toxicity. And for streptomycin, the side effect is ototoxicity and neurotoxicity. Next, the fluoroquinolones, for that, side effect is neurological. Next, the complications. So, the main complication is for the pulmonary tuberculosis, that is pleural effusion. So, fluid can shift into the pleural space and it can cause pleural effusion. Then the pneumonia can be a sign of, or can be a complications of pulmonary tuberculosis. So the alveolar walls became thickened and that causes pneumonia. Then the other side effects are extrapulmonary tuberculosis can occur due to pulmonary tuberculosis. There can be chances of developing extrapulmonary tuberculosis. Next, the multi-drug resistant tuberculosis, MDR TB, can be developed. Patient not responding in any drug, in any first line drug. These are serious reactions to drug therapy. These are the complications of pulmonary tuberculosis. The nursing diagnosis for pulmonary tuberculosis, those are ineffective breathing pattern related to pulmonary infection and potential for long-term scarring with decreased lung capacity. Next diagnosis can be imbalanced nutrition, less than body requirement, related to poor appetite, fatigue and productive cough. Next, the hypothermia related to presence of infection secondary to pulmonary tuberculosis as evidenced by measuring body temperature. This is all about the pulmonary tuberculosis, but the dots, the treatment, that is directly observed treatment short course chemotherapy, which is used to manage the pulmonary tuberculosis cases. So that is needed for a next class.